Assalamualaikum warahmatullahi wabarakatuh. Good morning, ladies and gentlemen, the jury, PIT Perdami 48 Committee, and all the audiences. My name is Rizki Matta Handayani. I am General Practitioner from Universitas Airlangga, Surabaya. First of all, I would like to thank the PIT Perdami 48 Committee for selecting this paper and allowing us to present our study entitled A Risk Factor Study of Visual Acuity in Pterygium Patients on Bawean Island, Indonesia 2023. Pterygium is a disorder of the eye due to the conjunctival fibrovascular overgrowth in the cornea. In high-grade condition, this fibrovascular tissue can grow across the visual axis and interfere with visual acuity. Usually, pterygium with poor visual acuity might require surgery as a treatment. These are several literatures that provides information about risk factors of pterygium, such as age of 40, male, hypertension and diabetes, and occupation are related to sun rays. But few of them are linked this risk factor to the level of visual acuity in pterygium patients. One of the studies mentioned locations in Asia that have a high prevalence of pterygium, and it included Indonesia. Hashemi et al. 2017 note this area as pterygium belt. It was then proved by Rizki's data 2018 that an 8.3% prevalence of pterygium found in some small island Indonesia. As we can see here, Bawean Island is one of the most northern island of Java, where most of population work as fishermen and farmers that are at risk of pterygium from excessive exposure to UV rays. This study aims to find the relationship between visual acuity in pterygium patients and its risk factors among the people of Bawean Island, Indonesia. The study design is an analytical cross-sectional by conducting a total sampling of pterygium patients examined by ophthalmologists. Research was conducted along with social services at Umar Masud Hospital and Puskesmas Tamba on Bawean Island, Gresik in February 2023. These are several variables. For the occupational group are divided into three categories according to Agresidi et al. 2015 research. First group is filled by a job that less likely to be exposed by sun rays, such as teacher, office worker, or housewife. The second group is filled by a job that half likely to be exposed by sun rays, like casual workers, traders, and government employees. And the third group is filled by a job that is more likely to be exposed by sun rays, like farmer and fishermen. For the statistic, we analyzed the visual acuity of pterygium patient within the scale of good to blindness as a numeric variable. With Kolmogorov-Smirnov test, none of the numeric variables have normal distribution. So we use the Spearman and Mann-Whitney as statistic tests. So these are our results of the study. From a total of 62 pterygium patients, approximately 75 categorized as grade 4 pterygium with 41% moderate to blindness visual acuity. More than half of the patients are all female, above 50 years old, with 40% has an occupational risk of sunlight exposure, or as occupational group 2 and 3 combined. For the statistic result, show that age and occupational group variables are only at determinant level to visual acuity according to the statistical determinant criteria. Riau et al. 2011 suggests on how UV exposure can cause limbal corneal stem cell insufficiency. This condition leads to activation of tissue growth factor, which further lead to angiogenesis and cell proliferation. The limbal stem cells are damaged because of an UV light exposure or due to the patient age, causing conjunctivation of the cornea. So at the conclusion, although in this study there was no significant difference between visual acuity score and risk factors of pterygium, age and occupational groups determine the visual acuity score of pterygium patient on Bawean Island, Indonesia. That's all about my presentation. Thank you so much for your attention. Wassalamualaikum warahmatullahi wabarakatuh.